Hi, I'm Dr. J. Burness, and this is video number 5 in our ongoing PCS series. Today I'd like to talk about something we see in many PCS patients, anxiety and/or depression. I need to cover a little groundwork first, so stick with me and we'll get there. As I've said in previous videos, during a saccade, we're effectively blind. As if that wasn't enough, our sense of position about where our eyes and body are in space is also turned off during a saccade. And this is not a bad thing if our eyes get to their next target accurately, because it's all switched back on again when our eyes stop moving normally in less than 1/10 of a second. The problems arise when they don't get to the target, or if spontaneous movements happen without an intended target at all. These types of movements can happen because of a failure in the brain's normal ability to inhibit them. It's important to understand that most of the connections between our brain cells are inhibitory. That means most of what brain cells are saying to each other is basically stop, don't fire. Now, because neurons need to fire very quickly to control and coordinate incredible amounts of information, it's necessary that they stay on and ready to go all the time. We can think of this kind of like a race car. If you want to move quickly off the start, it's best to keep the engine revved up and your foot on the brake. When you release the brake or the inhibition, you go. So you're probably asking yourself, what does all this have to do with anxiety, right? Well, since most brain connections are inhibitory, when the brain is injured, we're most likely to lose some ability to stop neurons from firing. Basically, we can't keep our foot on the brake. So neurons can fire spontaneously. We can have unwanted eye movements, twitches, tremors, feelings, sensations, etc. Depending on the brain areas involved, we also may not be able to inhibit our emotional responses and reflexes as well. Our pupils can dilate and we can become light sensitive. Our heart rates can quicken and our blood pressure can go up. We basically become more primitive, more reactive, and less rational. So here's a common example. If you have PCS or dizziness, you may have noticed that you have difficulties walking down the aisles in a grocery store. You may find that you become more dizzy, anxious, or upset while you're in there. As you walk down the aisles, the items on the shelves on either side of you stimulate your peripheral vision. Now, the normal reflex in this case is to look at them. This is a very old, primitive, protective fight or flight reflex that's really designed to keep you alive and safe from predators. To survive, you need to be able to react quickly if there's a threat coming towards you from the edges of your vision. So movement in your peripheral vision will normally trigger a reflexive saccade toward it. A healthy brain can inhibit this reflex and ignore things in the edges of your vision. Injured brains can't do this as well. Your eyes may be pulled off target as you fight the reflex to look. You can feel threatened and anxious the longer this goes on. The same thing can happen in traffic on the roadway. Cars coming up alongside you in the next lane, they can feel threatening, causing anxiety. Generally, the busier the visual environment, the worse you may feel. So at this point, we need to talk just a little bit about brain anatomy. The midline area of the cerebellum is heavily involved in the control and coordination of these eye movements. This area of the cerebellum is hardwired to another midline area of the brain called the anterior cingulate gyrus. Because of this connection, stimulating either area can lead to an increased activity in the other area. The anterior cingulate is involved in the processing of emotional responses, including fear and anxiety. So while most PCS patients will be emotionally upset about their disability, there can also be an actual physical reason why many people with PCS suffer with anxiety and/or depression based on these connections alone. So excess eye movements can lead to anxiety, and conversely, anxiety can cause problems with eye movements. This is one reason why anxiety attacks can bring on a whole host of symptoms, including dizziness, blurry or double vision, weakness, and even numbness and tingling, especially around the face. Many patients with PCS wind themselves up badly with anxiety and worry, creating all kinds of bizarre symptoms. In order to free yourself from these symptoms, you have to carefully drive plasticity in the injured pathways where function's been lost. Do this indirectly at first and then directly once the function improves. It all depends on the specifics of the injury. This is why every patient must be examined before we can know what the best techniques may be in their case. So, once again, we see that brain injuries affecting pathways controlling specific eye movements drive many of the disabling symptoms we see in PCS. So that's it for this one. In the next video, I will discuss two related symptoms seen in many cases of PCS, namely light sensitivity and sound sensitivity. Thanks for watching.